Good evening, everyone. Good evening. Good evening. It is Thursday, December 18th, 2025, and you are tuned into a Your Healthy Java version of Java After Dark with our long-standing, I believe now our longest-standing partner, ABCD Health Services. And so we are um, excited to be here, but the topic of which we're talking this evening is very interesting. It's nothing new. It's actually part of the reason and the foundation in why we started almost 6 years ago. We're talking about two major respiratory diseases that come up in the winter season. This is what is known in public health as flu, COVID. We did recently talk about RSV as well, but tonight we're going to focus on flu and COVID. And also, one of the major ways that you can prevent from being even more sick is being vaccinated. And so I'm excited this evening to bring my co-host for the Java After Dark Health Services into the Java Cafe. Again, I want you all to do me a favor before she comes in. Hit that like button and also share this episode because numbers are interesting. I have some numbers in front of me about positive rates, ER visits, and unfortunately, in the worst case scenario, deaths. And so we still have to remember that there are family members with, remember the word comorbidities? We have to remember that though COVID has kind of dissipated and it's not at a pandemic stage as it was some years ago, we still need to keep the things in mind that we've been talking about the past few years. So again, please hit that share button and invite others into the Java Cafe. I'm going to bring in Maureen Scott, who is the Director of Health Services at ABCD. Maureen, how are you?
How are you?
I
Thank
am
you for
doing
having
well.
me again. Thank you for having me again, Jimmy. And
Absolutely. It's our last show for the year for Your Healthy Java After Dark with ABCD. So I'm excited to have you here. Maureen, if I was to ask you just by your observation, I'm not sure if you still see patients directly, but from what you're hearing and seeing, like if you were to describe this flu and COVID season in one word, what word would you use?
well, to stick with the topic, preventable.
Preventable. Okay, absolutely.
Preventable.
And
Yeah.
so we know that ABCD Health Services has a network of partners, and one of them is Children's Hospital. And so, if you could tell us about our wonderful partner that's coming in today, Dr. Addison is coming in, and just tell us a little bit about that partnership. And we're going to bring Dr. Addison in just a few moments.
Hey, everyone. Thank you for having me again tonight. Our partner that is going to be on tonight to talk about flu and COVID and vaccination prevention is Dr. Jessica Addison. She's our new medical director. She works at Boston Children's Adolescent Young Adult Department. And we met her a few years ago when she presented at one of our clinical advisory council, and we fell in love with her. So I'm happy to present Dr. Jessica Addison.
Dr. Addison, welcome to the Java Cafe. We're glad to have you here this evening. How are you?
Thank you. Good evening. I'm great. Thank you so much for having me.
Absolutely. I want to ask you the same question that I just asked Maureen. If you could tell me by your patient population and visits, how would you describe this year's flu and COVID season? If you were to use one word, what would that word be?
I would probably say challenging because the flu is very contagious. It can spread very fast. And I think there's been a delay in vaccinations and a reduction in people actually getting the vaccine. So it's been really challenging to combat.
And we know that, this came up during COVID. Maureen, you remember, I'm sure Dr. Addison as well, that, there were a lot of concerns about, vaccinations and whatnot. And we tried to dispel misinformation here. And so we're going to talk about that in a couple of seconds. And so let's just level set about where we are with the flu season and COVID. And so, Maureen, if I could ask you, if you could just share with us one of the things that you said, your word was prevention, and that is through, getting the vaccination. But let's talk about where we are nationally on a state level. And I'm not sure if we have municipal, the health commission's numbers, but where are we nationally, even with vaccinations? Where are we with this flu season and COVID?
For this flu season, there's been about 1.9 million cases of it's the flu vaccine, so the respiratory illnesses. There's been about 19,000 hospitalizations and 730 deaths this season alone. For our community, the Boston, Suffolk County, there has been, let's see, for the vaccination rates, it's only been about 29.2%. And there's been at least 6 adults deaths in Suffolk County, in Massachusetts, I think, Massachusetts or Suffolk County, but that's too many. That's too many. And flu season runs from like end of June to where we are now.
Dr. Addison, may I ask you, just you're in clinic, you see patients, you know, do you share with them the importance of vaccinations? And based on what Maureen just shared with us, some of these are preventable. We don't know all of the 6, you know, and these are lives. These are not just numbers. So we just want to say that these are lives, and they have family members that love them. We don't know all the details of their case or their medical history. However, Dr. Addison, are people better positioned when they get the flu and COVID vaccination? Are they better positioned to be healthier?
I agree with you 100%. I think you are in a better position to be healthier, especially like you said earlier, if you have chronic health conditions, so asthma, diabetes, lung disease. If you do get the flu, that could make those conditions worse, and it can be a really challenging time. I think when talking to patients, I offer all of my patients the flu shot or the COVID vaccine, and I think it's really important when you're trying to talk to patients that you're non-judgmental, patient-centered, ask open-ended questions about their beliefs. You want to make sure that you're listening, and you want to validate their experience, because sometimes there's a reason why they decline. And I think it's really a shared decision-making process, but I think you have to take into account what they have been through, what their family has been through.
That's one of the major things. Again, you know, and I love how you said you have to respect where people are. Everybody doesn't have the same school of thought around vaccinations. And we used to talk about the fact that the benefits outweigh the risk. You know what I mean? And so that is absolutely important. So let me ask this: why does it matter? And again, it's interesting that I find myself reiterating this. Why does it matter that we take care of ourselves with these respiratory diseases? And one of the ways being the vaccination. If Dr. Addison, if I could ask you in this segment to answer that question, why does it matter?
It matters because what Maureen said earlier, it is preventable. When you experience the flu, it has a lot of consequences. It can have a lot of long-term consequences. And I think that if you're able to prevent it, I think that's the best way to go. Especially, you know, people, it's like cold outside, people are inside more, you're spending time with family who might have chronic conditions. So it's really like not protecting yourself, but also protecting others, your loved ones.
May I ask you this, either Maureen or Dr. Addison? We know that the flu season, as Maureen said, is from about, I believe, July usually till November.
Well, till now, like actually it goes into the beginning of next year, early spring. So
absolutely. And so the numbers, you know, Thanksgiving happened. We know that in public health, you know, during the holidays, numbers pick up. Everybody's around everyone. You're communicating, people coming from out of town, different things. There are different strains of the flu. And so, Dr. Addison, may I ask you, are you noticing that numbers have went up since the holidays?
I would say that we have a lot more urgent care and sick visits being booked after the holidays because people are together. You know, you're probably less likely to wear masks now in, you know, gatherings. A lot of people are touching your surface at home that usually don't live with you. So we have seen an uptick in sick visits after the holidays.
And Maureen, according to the data that you've seen, where are we with like urgent care visits? Are there hospitalizations up? Where are we with that as far as oh God, I can't believe we're using this terminology again. the strain on our hospital systems, and I'm sure it's not bad as it was, 5 years ago, but where are we with hospitalizations?
They are increasing. And the problem with the fact that they're increasing is that the vaccination rate is decreasing from last year. There was in hospitalizations in Suffolk County alone, there was 131 emergency department visits were for RSV alone. Then the increased ER visits related to flu. There's also the respiratory illnesses that aren't positive for flu. There's a whole slew of viruses out there that people don't realize. Some people do feel that they've gotten the flu vaccine and they're still getting sick. So what's going on? There's so many viruses out there. The flu vaccine takes care of the major flu, the strains that get you in the hospital, that cause hospitalizations, that cause the sequela, like the complications later on, and deaths. And I think that's what the misinformation is, that you get the flu vaccine, that you're not going to get the flu at all, you're not going to get sick, and that's not true.
And we have to understand that there is a difference with, I said a few moments ago, people coming from out of town, there are different strains of the flu, still different strains of COVID as well. And so both of these respiratory diseases tend to have similar sort of symptoms. And so let's go through some of the symptoms. So if you have any of these, you may want to think about, Dr. Addison, you're smiling, and I'm sure you share the same information. Why were you smiling there? Did you know where I was going with this?
No, I feel like I do, but I'm going to let you finish and then I will add on.
Absolutely. So let's talk about the symptoms. And then if you have any of these symptoms, you might not want to go eat the chitlins at grandma's house because you don't want to get grandma sick. Some will say you may just not want to eat the chitlins, period. But, no judgment over here. And so, Dr. Addison, can we go over some of the symptoms? And Maureen, I'll come right back with you as we get ready to talk about other ways to prevent. We've mentioned the vaccination, which is a very good way, but then also masking up if you may have these symptoms and you just must be around people. And so, Dr. Addison, what are some of the symptoms of the flu and COVID? And then can you talk a little bit about the difference between the two?
Sure. So usually with like the flu and COVID, you can have fevers, chills. Cough is very common, in addition to sore throat and runny nose. Body aches is common in both of them. Headache and also fatigue. I would say sometimes the fatigue is a little bit more pronounced in COVID. You can also get vomiting and diarrhea, but that's usually in younger populations. And the flu symptoms can come on very quickly within 24 to 48 hours of acquiring the virus. And I would say for COVID in particularly, COVID is still a fairly new virus to us. So any other symptoms, even something such as rash or something such as COVID toes, we're learning about COVID still. So if you feel unwell and you're noticing symptoms that are like not common, then I would say you should get tested.
I was going to just ask about that. And Maureen, you can jump in here, and Dr. Addison as well. Are people, well, you don't know everyone, but are you still, are we encouraging people with symptoms to test? And are people, just by your observation, Maureen first, and then Dr. Addison, you, are people self-reporting still testing? Oh, Maureen, hold on for 1 second. I got you here. There you go.
It's a mixed bag, Jimmy. A lot of people seem to think that, and I've heard Uber drivers say, COVID's not there anymore. People, that's just talk. It's really a mixed bag. Some people, they get cold symptoms. They may come to work and wear a mask. Others will just say, I just have a cold while they're spreading COVID. So it's really a mixed bag on what people feel. I mean, COVID is still out there. It's clearly still out there. I mean, if you go through the airport and you come back and you get sick, do a COVID test. But some people do have the feeling that it's not really there, or it's not really that bad as it used to be. It's still bad. And it's still contagious. That's what you need to know. It's still contagious.
Dr. Addison, if I may ask you, what are you seeing in clinic? And you're at Children's Hospital, so you're working with younger patients. But what are you seeing as far as our parents testing? parents testing their children, because during COVID, if you were under the age of 16, I didn't want to be around you. I didn't want to see you. I didn't want to have anything to do with you, because we know that our younger people, tend to be little germ carriers anyway. So what are you seeing in clinic as far as still testing?
So when someone comes in with sick symptoms into clinic, we are still testing everyone. The CDC guidelines have changed over the past couple of years on what to do if you do test positive for COVID. Before, you used to have to go into isolation and make sure you had no symptoms and make sure that you were masking. But, sometimes COVID symptoms can be milder. You can test positive. And the recommendations really are like to wear a mask, maybe not go out in public or back to school until, your symptoms are gone. But I think COVID has changed the way that we live over the past couple of years, because I think before COVID, it was very common to go to school when you were sick. It was very common to come into work when you were sick. And I think things have changed now. I think a lot more people are masking. A lot more people are trying to prevent the spread of these viruses now.
Yeah. That's one of the things that I'm remembering terms like also physical distancing. It's just interesting that Maureen is laughing at me because I'm just sitting here like, wow, we still
don't see it happening. That's why.
Well, Dr. Ojukutu is the commissioner of public health. I had her on, I believe it was in either late 22 or early 23. And she said that we're going to see another pandemic in our lifetime. And it's just interesting. And so while, we don't want to be doom and gloom, and we want people to be able to still function, because we know there's a mental health impact of being around family and things like that. Maureen, we talked about that in our last episode. There's the good mental health impact, and then there's some family functions where you may say, yeah, I won't be there. And so what are some things that we can leave our audience with? Maybe Dr. Addison, if you are symptomatic, and one, this just came to my mind. There was a lot of talk about not getting vaccinated when you're sick. What are some of the rules around vaccination? Mm-hmm. And if you want to specify between flu and COVID, please feel free to do so as well. And Maureen will come right back with you as well.
Mm-hmm. Right. So, if you are not feeling well and you do get the vaccine, that's okay. I have a lot of families and patients who prefer to come back when they're feeling better to get the vaccine. But if it's not a contraindication to get it if you're not feeling well, because it's hard to say, like, if you have the flu, if you have COVID, I don't know what you have, but you can still get it. You might feel a little bit worse after getting the vaccine, but that's any vaccine. You can get a fever, you can get a sore arm. But even if you're not feeling well, you can go ahead and continue to vaccinate.
Dr. Addison, if I may ask you, just give us a little 30-second of the science of vaccination for those that are not aware. You would think that all of us know about the, what is it? The RNA and mRNA and all that other stuff. Give us a 30-second, just what a vaccination does and what it is, because layman's terms, there is this, you are in some cases with the vaccination getting a little bit of the virus in your body. So if you could just educate us about that, and Maureen, we're going to come back to you.
Yeah, so vaccines really teach your immune system to fight germs by showing it a weakened or inactivated part of like the virus or a bacteria. So when your body gets exposed to this like little inactivated part, it prompts your body to create protective antibodies and memory cells without causing the actual illness. So if you encounter the virus or the bacteria later, your body recognizes it and can quickly fight it off.
And Maureen, I'm going to come to you in 1 second, but I just wanted to make sure that people understand that there are more benefits than there are risk when you deal with different types of vaccinations. So Maureen, if I could ask you, what are some other prevention tips? During COVID, there are some things that we were just raised to do just to be clean, but let's review and talk again. What are some ways away from the vaccination in our everyday daily practice that we can help stop the spread of germs?
Well, washing your hands regularly is one of the big things. It's something we take for granted. But in through all of this, I do see that people are, doing more of that. Carrying sanitizer with them, washing their hands more, cleaning off your common surfaces in the house, especially if someone's sick, and open the windows and let some air flow through the house. I know that it's cold, but it's good. When you're ill, this is holiday season, you may have to miss that party, even if you have a cold, spreading it to someone that's much older than you, that has some chronic medical problems. A simple cold would put them in the hospital or even in the ICU. If you're sick, before when we had a cold, we go to bed, we rest and everything. But if you really feel like it feels a little different, have a self-home COVID test or seek help. Sometimes being sick can lead to having pneumonia or bronchitis. So the colds just aren't simple like that anymore. Wear a mask. When you go out in groups, wear a mask. The stigma for wearing masks, I don't really see that anymore. You'd be at a big fancy gala and there's someone there with a matching mask matching their gown. Physical distance does work, and testing from time to time, and just protecting the people in your home is so important. Keep your children home when they don't feel well. I know it's hard to miss work, but it's schools. If you're sending your child to school sick, you're making another child sick. So
And then, and therefore, when you have children, if I get sick, it's here with me. I'm single and I'm good. I'm down for about maybe 4 or 5 days at most.
Yes.
When you have, I'm gonna be nice. When you have those that are 16 and under running around, that thing can stay in your house for 3 weeks, if not longer.
Yeah.
So these are again, on one hand, I'm like, we're repeating and we're sounding like we're back during COVID-19, but these are respiratory illnesses that are spread through, if I'm right, droplets, air. These are airborne pathogens. A little microscopic droplet of someone saying P or T to you while they're sick and it lands on your lip and you talking and you lick your lip and then 2 days later. Am I exaggerating, Dr. Addison?
No.
Or Maureen, I'm not exaggerating. This is very, very real, and we just don't know. We make, I said earlier about grandma's house and the chitlins. Comorbidities are still real.
A lot of teachers keep sanitizer in their room, if you notice, in their classrooms, and they wipe the surfaces off. You should wipe the surfaces often. The kids touch everything. They touch each other.
Yeah, even when you're transporting from work, you're on the T, you're in an Uber. I mean, there's just so many points of contact before you get to your home.
Y'all gonna have me now. I'm sitting here rubbing my right leg. I'm like, okay, I got to go get Lysol. I got to sit. And I mean, it's now become such a habit to walk around with a sanitizer on your keychain, to have sanitizer in your bag, on your person. It's just very interesting. So I wanted to review what we talked about this evening. Maureen, if we could quickly just, COVID numbers and flu numbers are up, but vaccinations are down.
Yes.
Maureen, can you just give us, and Dr. Addison, I'll ask you as well, what are some of the reasons maybe that people may not want to be vaccinated?
Well, I can say that they may have heard horror stories from their family. Maybe they got a COVID vaccine or a flu vaccine, and coincidentally they got sick with the flu. Maybe they got the vaccine, 2 days later they were sick, but they may have been infected already. It's hard to convince someone who's got sick with the flu that to go back and get the flu vaccine again. I've read stories, and it may have been other reasons, coincidentally, that the flu vaccine, their parent or their relative died because of a vaccine. There's a lot of stories out there, a lot of misinformation, but there are people that have allergies to maybe something in the vaccine. So, it's hard to explain to someone that that vaccine is going to protect them if they think it's going to harm them, especially if they've had a personal they've had some person in their life that was really badly affected by it.
Dr. Addison, anything to add there?
Yeah, I agree. Also, there's, religious reasons. I've had families say, well, I've never had COVID or flu, so if I've never had it, why do I need to protect myself against it? Also, if you do get the flu shot or the COVID vaccine, and later on you do get flu or COVID, the symptoms are going to be significantly less if you have the vaccine. So it doesn't mean you're not going to get flu and COVID. It just means your symptoms will probably be lessened. Maybe the duration will be less. So there's still benefits to getting it, even if you get it down the road.
Right.
That's one of the reasons I was saying earlier, Dr. Alabre from MGH had mentioned this, that the benefits there are risks. There are risks with our daily medications. You take a risk when you walk out the house and when it's cold, and you can slip on some ice. So there are risks, but the benefits, less impact of the flu and COVID, and maybe less time, and decreases the potential of hospitalization if you have things like, let's name a couple of the comorbidities rather, respiratory ones like asthma, COPD. I forgot what COPD, congestive. What is it?
Obstructive pulmonary disease.
Chronic obstructive.
Yeah. I've been out of pulmonary and critical care for a few years now. Asthma. If you have, because regular severe allergies, though not diagnosed with asthma, that can trigger something with your respiratory system, and you just don't know. And so we just have to keep these things in mind, not only for grandma, but there could be a little 8 or 9-year-old that has a comorbidity. So I just wanted to review just a couple of things again before we get ready to wrap up. A few things. One of the major, this is the number one thing that you can do, even if you don't have sanitizer. What is it? The alphabet? Wash your hands for as long as you say the alphabet.
Or sing happy birthday.
Happy birthday. Well, in my case, it's a little bit longer, but and make sure that you get all of, this is crazy. I remember all this stuff during COVID. All right. So wash your hands regularly. Also, clean common surfaces, doorknobs, light switches. If you're in an Uber and you touch the door, as soon as you get in, sanitize your hand, because we have this bad habit of, if something itches, I remember Dr. Bricks, don't touch your eyes, don't touch your nose. And all right, I'm going back to COVID. All right. Also, this is a hard one for some, but think about you getting someone sick. If you have symptoms and don't feel well, consider not attending holiday events. Right. Let's take a harm reduction approach. If you must, mask up and then stay distant. Well, first of all, these days, if you're at the gala and you got on a matching mask, I'll say for myself, good to see you. How you doing? I'm not hugging you. I'm not, because you got that mask on for a reason.
But they may be protecting themselves too.
That is wonderful. And if you got it coordinated with your outfit, it's more than likely for protection. But if you're wearing a blue mask, that means that, but then I don't want to put any judgment on people. Okay. So, the other thing is, if there is an event that you just have to go to, mask up, stay physically distant, make your appearance, and take your happy self home. Because one, you need to rest. Let's talk about hydrating and sleeping. Dr. Addison, why are two simple things like hydrating and sleeping important, just generally, but even more so when you're sick?
Right. So, your body is down, your immune system is down. Anything you can do to restore the energy that you're losing, restore any fluids you might be losing, like vomiting or anything like that, really helps your body fight the virus. And
Maureen, is there anything, I have a lot of seniors that are part of the Java Cafe. Is there any advice that you would give to seniors, because they are seniors, and I believe newborns, children, comorbidities, no matter what age, those are our special populations that we have to keep an eye out for. What would you say to our seniors, just to either about symptoms and also not, because sometimes some of our seniors will just go through it and try their little home remedies.
Right. Well, first thing, I have to reiterate it again, vaccinate. because if you're a senior and you do get one of these illnesses, it can lead to some long-standing problems after that. I mean, it also has like outstanding like sequela, like you can end up in the hospital, you can end up with pneumonia, bronchitis. Pneumonia has caused death. If you're not feeling well, stay home. And I would say get your rest. I mean, some seniors don't have much problem getting rest, but mask up when you're out amongst a lot of people, because the risk is so severe with you getting this infection of getting worse. It won't just be a week laying in bed or a few days on the couch. It may lead to other problems, and chronic lung problems. And if you already have a chronic lung problem, that's not looking good. So I would definitely say mask up with seniors, if you're out in crowds, and limit the people. I mean, it's hard to say don't come over if you tell your family if they're sick, don't come over. But sometimes you have to say that. Well, actually, a lot of seniors don't have a problem telling you what's on their mind. So if, you know, the little ones that come around, if they're sick, don't bring them around the older.
And you got your little party and gala to go to with your mask. Don't be relying on the seniors to babysit that night, because 3 days later they're asking you to take them to the hospital.
Right.
Yeah. And I would also say for that demographic, seek care if you're not feeling well. A lot of people, you know, just stay home and things get worse. You want to make sure that you're, you know, treating your symptoms early to make sure it doesn't.
Right. There is medication you can take within the first few days. So, you know, within the first few days, please get tested at home, tested with the doctor, and take the medication. It'll cut the symptoms down within a few days. It'll cut a few days off of that. It really works. I know I had to take it. It does work.
As long as you take it within 48 hours of symptoms start.
Exactly.
So you have to be real with yourself about the symptoms that, you know,
Right.
it's because a few weeks ago I was struck. I'm like, is this allergies? Is it COVID? And it ended up being allergies with the burning eyes and all that other stuff. We usually don't take questions, but I do. This is a general enough of a question that I'm comfortable asking both of you. Typically, how long does a virus hang around on a surface?
Oh, I know more than a few hours. I mean,
Yeah, I feel like the flu virus can stay on,
stay on for a while.
like that for like at least 24 to 48 hours.
Yeah.
Maybe shorter time for, you know, other surfaces, but like for the main surfaces is usually can be up to a couple of days.
Right.
Wait, so you I'm stuttering. So someone can come over and sneeze and on Monday, and on Wednesday morning, if housekeeping, or I'm thinking about a hospital, if the surface didn't get clean and you come and you touch it, and 2 seconds later you know your eye itches. Yes.
Yeah. I mean, yeah, and you know,
Anita said
why it's good to
Mhm.
continue,
Mhm.
especially if you're having company come through, just continue to disinfect.
I just
And never forget that picture when someone sneezes and the big wide angle of all the drops in the air.
y'all worried about chitlins and here we are around people sneezing and whatnot. All right, we are going to get ready to wrap up. I would encourage you to please, the number one thing that you can do if you have symptoms is check with your primary care physician. I know that there's a shortage of primary care providers, but your health center, call them. If you get into some sort of crisis and you're having trouble breathing, call 911. That is what you should do. And our seniors, again, you know, don't stay at home and do the home remedies. And I know and our younger people, there's a lot on the internet about the garlic and the honey. And then there's you take the pineapple, the oranges and something else, and you boil that, you steam that, and it's just gonna get all the mucus and everything right out.
Don't forget about the garlic and putting the garlic in the ginger tea.
Garlic in the ginger tea?
Yeah, that's one I heard about.
Okay, see, there's a lot of stuff out there. While some of this stuff may help, because our ancestors and our old, you know, they did what they did before we had pharmacology.
Right.
However,
all about symptom relief. You know, they're looking for symptom relief.
Yeah.
But if it is the flu, or if it is COVID, then, you know, yeah, you're going to get through it eventually, but we just don't know how are you going to get through it?
And we helped somebody tonight. Miss Anita said, okay, thanks. We'll definitely increase wiping down with sanitizer and household services. 48 hours, Dr. Addison. Ain't nobody been over here, but I'm about to go hit the doorknobs. I'm about to go wipe the counter with the Clorox wipes. And no, nope, can't get sick. All right. My sister said yes to garlic in the ginger tea. Okay. Did we miss anything, Maureen or Dr. Addison?
I just want to say, like, the takeaway is that when you get vaccinated, you're just not protecting yourself, you're protecting your family, you're protecting your community. So with the facts are there that the illness is rising and the vaccination rate has gone down since last year. For the last 2 years, it's been steadily decreasing. So the most simplest way we can turn this around is to get vaccinated. So give it another thought.
Yeah. And I would say, talk to your provider. There's a lot of myths, there's a lot of misconceptions. So I think having an open conversation with your provider will also help.
Yeah.
All right. I just want to reiterate and remind everyone again that both the flu and COVID vaccinations are down. And the numbers are up. ER visits, urgent care visits. And so far here in Suffolk County, we've had 6 deaths due to either the flu and or COVID. And so those generally are preventable by getting the vaccination and wearing your mask and wiping down surfaces and washing your hands and sanitizing. So please keep that in mind. And also don't forget there are other diseases out there as well, such as STIs and HIV. Don't forget that ABCD has 3 kiosks at 110 Claiborne Street in Dorchester, 565 Warren Street in Roxbury, and 574 Parker Hill. Maureen.
714 Parker.
714, yes, 714 Parker Hill, over in the Fenway area. And so listen, don't be sitting around you getting the flu, and then anyway, so we're going to get ready to go, and then you worried about some other diseases, and some of those don't have no vaccinations. I know we got PrEP and Doxy Prep and all that, but all right, we're we really going to get into it after dark, so we're going to leave that alone and not scare Dr. Addison away. But, Maureen, thank you so much to the team.
Thank you so much.
To Lee, Jamie, Sharon, and everybody, Jason, everybody over at ABCD. Thank all the team for making this happen. This is our last episode for the year. We will be back in January to talk about human trafficking. That is a public health. That is a health issue. Mental health, physical health, public safety. That is an issue. And we're going to talk about that in our After Dark in January. So please stay tuned for that date. Both Dr. Addison and Maureen, thank both of you very much. I'm going to go pay some bills after both of you leave, and we will see you both very soon. And again, Dr. Addison, thank you. I used to work in the ER over at Children's.
Wow.
And yeah, I remember things like CCHP, YPP, over I don't know where it's at now, but it was in the original building over at 300. So thank you both for being here with us this evening. And if there's any developments or any information we need to get to the public, please let us know, and we'll be glad to disseminate it.
Thank you so much.
Thank you.
Thank you both for being with us this evening.
Yep. Happy holidays, everyone.
Holidays.
So, thank you. Hopefully this evening, everyone, if you have not been vaccinated, you are encouraged to contact your doctor and consider getting the vaccination for the flu and also COVID. And I know there was a lot of conversation. We don't hear as much about it. And here of late, I've been seeing things on social media about, oh, I told you so. They're now saying the COVID vaccination was this and was that. Get it. Okay. That's it for me this evening. We will see you on Monday at 10 a.m. with City Councilor Gabriela Coletta Zapata. I got the whole thing right. I've been forgetting this week. He's coming on at 10 a.m. on Monday, and at 10:30 a.m. we have back Henry Santana, who is a city councilor as well. And then on Tuesday at noon, we have former city councilor Tanya Anderson will be with us for midday Java at 12 noon. I have not decided if we're going to do 10 and 12. Right now, we'll just have midday Java, but we'll let you know on Monday. All right. And that's it for me. We will see you on Monday at 10 a.m. Have a great, safe weekend. Remember, if you don't feel well, consider staying your happy self home and don't go out there and get other people sick. Have a great